So I'm really excited to speak with my colleague, Sankar Alagapan, about his thoughts on this landmark paper on which he's the lead author. And I'm really interested to know how it is that you came to come work with Dr. Rizal and participate in this study.
As a biomedical engineer with some background in neuroscience, I was motivated to find places where my skill set would directly help people. And the fact that I would get to work with some of the latest technology in terms of AI and also the latest or one of the cutting edge therapies in terms of DBS was a big motivator for me to join this project.
What are the things you're most happy with to have discovered over the course of this experiment?
One of the things that we have shown in the paper is that the changes in the brain is not linear. This has been something that your work has alluded to and other work has alluded to. There is a lot of plasticity happening in the brain, and we show some evidence for that in this paper. So that is, the neuroscientist in me is really excited about that result. And apart from that, the ability to use novel technology like explainable artificial intelligence in the context of treating mental health disorders, that is really exciting for me.
Do you have any surprises working with us?
Yes, there are a lot of surprises. The main surprise was how clinicians come about their decision. As a person who is very comfortable with working with numbers, when I saw that there are these measures of depression severity, thought this is an easy problem. I can take those numbers, take the numbers from the brain, put them together, and I'll get the answer. But then it turned out that that's not how the brain works, how a person suffering from depression recovers with this therapy. Working closely with the clinical team helped me appreciate the nuances of this therapy, and that led me to change my approach to this problem, and we were able to get a quantifiable information out of this, but that is actually rooted in clinical decision making.
Are there things that you take forward now that you'd like to see done next, now that you have this experience with us?
Yes, so I would like to see two things. One is we have this quantifiable measure from the brain. Can we use that to inform clinical decision making? And the second one is there are still something that we are not able to explain with our measure that we have got now. Can we use a similar approach that you have taken so far and get at these questions? What I mean by that is there are periods where we are seeing patients experiencing some disturbance in their behavior, but we don't have the corresponding brain signal. So I would like to carry forward and identify that brain signal if possible.
We know this paper that you've led with our whole team is really just foundational for the next step to really explore how people get well, how people stay well, how to have signals that can help clinicians, not replace clinicians. And I think the future of collaborations between engineers and clinicians is here to stay.